Discover the latest news and advances in the field of health and medicine. Subscribe to our channel now to stay up to date with the latest medical news, from innovative treatments to promising research. Be the first to know what's temporarily in the health world and begin your journey to a healthier, more in control life. Rehabilitation of erection beyond radical prostatectomy. Hélène Joubert. France, the concept of erectile rehabilitation is part of the field of secondary prevention, i.e., preventing erectile dysfunction that arose or was diagnosed as a result of an acute episode becomes chronic. The concept of erection rehabilitation after is radical prostatectomy, the context in which the technique was most studied and put into practice, applicable to other populations? Professor Dr. Stéphane Droupy, urologist andrologist surgeon at the Centre Hospitalier Universitaire de Nîmes, responded. This question in the Journées francophones de sexologie et de santé sexuelle, JE3S, 8-10/09/22, Montpellier. 1. Prostate cancer is emblematic of the diseases that cause sexual disorders, erectile dysfunction in particular. Could other pathologies of less symbolic organs also benefit? Erection rehabilitation, what is it? Erection rehabilitation is the early control of erectile dysfunction after a radical prostatectomy. Your goals are to improve the quality of erections during the recovery period, about 2 to 4 years, if there has naturally been preservation of the nerves, allow the resumption of sexual life in the postoperative period, and, perhaps, prevent the occurrence of permanent sequelae. The concept has evolved over the years, from just early and systematic intracavernous injections in the late 1990s. 2. For daily long-term phosphodiesterase type 5 inhibitors and integrated global control. Type 5 phosphodiesterase inhibitors, intracavernous injections, vacuum, sex therapy, replacement in testosterone deficiency. In general, today, 25 years after the first publication on the subject, there is no consensus protocol for erection rehabilitation, said Professor Dr. Stéphane. What we do know is that, whatever the technique, the result depends on both time and technique. Quality of vascular and nerve preservation, with a recovery of erections between 30% and 85% in case of preservation. Bilateral, and from 15% to 55% if it is unilateral. 3. 4. Don't wait too long and be patient. So far, the study of pharmacological recovery after a real-life prostatectomy has not shown convincing results. Probably in part because the duration of most studies did not exceed 9 months. An 18-month study, 5, suggests that a proactive attitude is beneficial, providing quantitative and qualitative improvement of erections without pharmacological assistance. 52% of patients in the rehabilitation group versus 19% of patients in the non-rehabilitation group. The efficacy of phosphodiesterase type 5 inhibitors, sildenafil, was better in patients who underwent rehabilitation, 64% versus 24%. The precocity of this rehabilitation is important. 6. Early prescription of 100 mg sildenafil, for 3 months. Provides better results than 100 mg of sildenafil started in the third postoperative month, for 3 months. In terms of erection quality, at 12 months, 41.1% versus 17.7%. An infinity of parameters intervene in the recovery, said the urologist. The determining factor for erection quality. Postoperative period, rehabilitation with 5 mg of tadalafil for 9 months, is satisfaction with sexual intercourse before the operation, carrying out of the robotic operation and the preservation of the nerves. 7. Extension of the concept of erection rehabilitation to radiotherapy. The deterioration of sexual function after brachytherapy is important, mainly because it is associated with chemical castration and radiotherapy. 8.9. Prostate cancer, benefits of erection rehabilitation after prostatectomy and brachytherapy. All prostate cancer treatments induce sexual sequelae, especially in erection. In a publication, radiotherapy teams tested daily rehabilitation with phosphodiesterase type 5 inhibitors for 6 months. Sildenafil 50 mg per day versus placebo, 2:1, in 279 patients, said Professor Dr. Stephan. At 24 months, 81.6% of men in the sildenafil group and 56% in the placebo group reported functional erections with or without treatment, p equals 0.045. There was no difference between brachytherapy and radiotherapy. In fact, during the recovery period, erections are better in the sildenafil group, but when the drugs are stopped, the quantity and quality of erections are similar. For all men, the phenomenon of erection rehabilitation, therefore, is not supported by this study, despite its positive conclusions. Another study done with tadalafil was not more successful in preventing the chronicity of erectile dysfunction. In short, even with the difficulties of proving the concept of erection rehabilitation, we think it is better to benefit patients. Rehabilitation of erection after cystectomy, stroke and pelvic fracture. Any interest? On rehabilitation of erection after cystectomy, 12, a comparative study of 160 patients with cystectomy, with or without preservation of nerves, tested no treatment compared to treatment with phosphodiesterase type 5 inhibitors. In monotherapy, intracavernous injections in monotherapy, and the combination of phosphodiesterase type 5 inhibitors with injections. Intracavernous. Overall, the different rehabilitation solutions do little better than nothing, explained Dr. Stefan Drupi. And the main condition for the hope of recovering satisfactory erections remains the preservation of the nerves. After rectal cancer, a disease in which the prevalence of sexual dysfunction is highest, 13, a slight benefit seems to be emerging in favor of erection rehabilitation in 2 relatively recent studies, with sildenafil and sildenafil, but which still needs to be demonstrated. 14.15. Few studies, small samples, short study durations, demonstration remains difficult. After stroke, pharmacological intervention studies were not performed. 16. After pelvic fracture, the interest of erection rehabilitation is somewhat more documented. It is estimated that the frequency of dysfunction, erectile dysfunction, is 35% to 48% in case of bladder injury and 58% in case of urethral rupture. A study published in 2021 is more favorable to interest in this rehabilitation, using phosphodiesterase type 5 inhibitors. 17. Finally, after acute myocardial infarction, when the prevalence of erectile dysfunction fluctuates between 50% and 79%, improvement in erectile function is observed with the resumption of physical activity, in this case, the 60-minute walk 4 times a week. 1819, the authors found that the phosphodiesterase type 5 inhibitors were associated with reduced mortality in patients with compensated ischemic heart disease, as well as in patients with recent acute myocardial infarction. Randomized studies should be done to better understand how phosphodiesterase type 5 inhibitors work after acute myocardial infarction. Implement structured multidisciplinary care. Finally, the indications for rehabilitation of erection are numerous because the critical episodes in the origin of erectile dysfunction or its diagnosis are numerous, summarized Professor Dr. Stephan, like cancer in a very global way, even if there is no lung cancer study, including cases treated with chemotherapy, radiotherapy, immunotherapy, hormone therapy and/or surgery, but also in stroke, acute myocardial infarction, different types of ischemia, neurological accidents, pelvic fractures, decompensation of chronic diseases, diabetes mellitus, renal or respiratory failure. After hospitalization in an intensive care unit, characterized by collapse of testosterone levels, and until COVID-19. The specialist advises to recognize the symptoms, assess, inform patients and implement rehabilitation actions. These actions include improving communication and relationships between the couple and in the workplace, reducing the consumption of alcoholic beverages. Increase physical activity, stop smoking, reduce salt intake, balance blood pressure, control diabetes and normalize body mass index, assess cardiovascular risk and therefore reduce and treat risk factors, not forgetting to look for possible pharmacological iatrogenesis. After a critical event, we should look for erectile dysfunction, insisted the Dr. Stephen Drupe, and provide structured multidisciplinary care, therapeutic education, sexual medicine consultation or sexology. If, according to evidence-based medicine, pharmacological rehabilitation over a period of 6 to 9 months with inhibitors of type 5 phosphodiesterase does not significantly improve the preservation of erectile function at the end of treatment, early treatment and prolonged should be offered and adapted to the request of the patient/couple. Finally, an assessment should be made of a possible deficiency of testosterone, including in cases of prostate cancer. I hope this video was helpful to you and clarified some of your doubts. If you liked the content, don't forget to leave your like and comment below. Also, if you haven't subscribed to our channel yet, don't waste time and do it right now and turn on notifications. That way, you won't miss any of our upcoming videos. Where are we going? Share even more information and interesting tips for you. Thanks for watching. Until next time.